Hello, everyone. My name is Dr. Cynthia Correa Cedeno. I am a board-certified podiatrist and surgeon here in Orlando, Florida. I have a company, my own practice called Sky Podiatry. And I want to get myself more out there so patients can see that I'm here, willing to help. My practice is more holistic in nature, and I really just want to put myself out there. So putting on YouTubes and getting on the internet and talking about things. So let's talk about things. I recently saw a patient. I've seen many patients, but there was one that came in particular for something else, but we ended up talking about something deeper. This person came in for something, let's call it routine, okay? Something was going on with their nails on their big toes, and this pain kept waking them up at night. They didn't know what to do. They got really desperate and just kind of did whatever they could to make it better, even looked into more Eastern medicine kind of type things to help them with. They were just in a lot of pain and they wanted it to end. And they had a very hard time finding a podiatrist that they trusted, or honestly just finding any podiatrist, because a lot of us are overwhelmed in the healthcare system. So it's really hard to get people in. So we did a televisit because I couldn't see her in person, but we did a televisit and we went really deep into the problem. And we got so deep, and even in this televisit, I could see from the photos that something was going on with this person's foot. And although this person did have a more textbook ingrown toenail, but it wasn't infected. Infected would be called paronychia. She didn't have that, but the way that she was walking, because she was overpronated and a previous accident, she was putting more pressures on her big toes than she would somebody else that would be walking in a more neutral position. Neutral meaning that your foot, your ankle, and your knee are in alignment. And she isn't. So she's putting more pressure on her big toes and then putting more pressure on that ingrown. So, ouchies, that hurts. There's nerves, arteries, and veins all over that area that are being constantly irritated throughout the day. And the thing is, I listen to the person's emotions, their lifestyles. We talk about genetics, what else could be causing this. Sounds like this person had episodes of ingrown toenails since she was a little girl, but never got a procedure to remove them because she just doesn't want that. It's not something that she wants. She wants to find some other alternatives. So we did. Since this patient didn't have an infection, she could have utilized something called Onifex, which is a band, that you put around the toenail, and then you allow the nail to naturally grow without that incurvation. But in the meantime, you need some pain relief. So you got to look at the cause and then also treat the symptoms to help out the patient, right? I'm not going to be like, see ya, you're going to be having this pain for 6 months until Onifex kicks in. No. So things that could be done to help with the infection without taking more synthetic medication, a class 4 laser, pain laser, along the area that is painful. That is painless, but it takes away the pain. So that is very helpful. Also, little parts of the nails can be taken out without numbing. A lot of podiatrists call that a slap back. We're just kind of taking out little pieces. I call it arts and crafts. And then if the patient wants to move forward with the Onifex, we can do that. And also if all of that doesn't work, we can guide the patient into a procedure that best serves them. But also, even in that televisit, we discuss her anatomy and her history and discuss, hey, you are young, so now would be the time to address this wear down that I'm seeing in your foot caused by some of it genetics and then definitely some from a previous accident. So we discuss alignments and we discuss even custom orthotics for herself to realign that. So although this was a televisit, this patient got a wealth of information and guided into the right direction. So we got her in the right direction. And that was great. And that's what I love to do. I like to sit down and talk to my patients what's really going on so I can help you have lasting healing relief. I don't just want to put a little band-aid on you and then set you off. I want to listen to you. I want to listen what is going on socially, what is holding you back, where are the emotions here? Is there something genetic going on? Then go into the functionality and go into the medicine. Once we break that barrier, talking to my patients, I'm like, hey, you're a person, I'm a person. Let's figure this out. When we talk about it in a pragmatic way, we can get to where we need to go, get that lasting effect. So that is the way that I like to treat my patients. And I am excited for the future of my company and the patients that come and see me and get this type of relief and get this type of treatment. So thank you so much for listening. You have a great day. Bye. Hello, everyone, and happy whatever day it is that you're watching this. My name is Dr. Cynthia Correa Cedeno. I am a board certified podiatrist here in Orlando, Florida, and the name of my company is called Sky Podiatry. And today I wanted to talk about a patient that I saw. Now, this patient was young and they were concerned about